Bienvenidos una vez más. Hoy tengo la oportunidad de hablar con alguien que de verdad me interesaba hablar con ellos, con él. Dado el caso de que tenemos un corazón roto por igual. Doctor Saud, ¿cómo está?
¿Cómo estás?
How are you today?
Muy
Exhausted?
bien, muy bien. Mucho gusto. Muchas gracias.
De nada. You are really a doctor.
Yes.
People have asked me that before. I'm like, yes, he's a doctor. You got a tough election coming up. Tell us what you care about.
So every election is a tough election. We have to work hard, and we have to get every single person who is eligible to vote to come out to vote. And we can never take any single vote for granted. People have given their lives to get the right to vote, and we cannot waste any single vote. And now we have no excuse. We have some important issues to be able to overcome. One is the big challenge for people to vote has been that they're working from morning to night on a Tuesday. Now we can have early voting. And so from October 21st to the 3rd of November, you can actually come out and vote early. So we have every opportunity for people to vote. And then we need to take that opportunity and use our voice.
I'm going to focus on the doctor thing since
Yes.
we are living in times where lots of folks do not have access to medical care, can't afford medical care.
Yes.
As a doctor,
Yes.
where's your heart in all of this? Because I've seen some of your work, and I know you and I share a love and a commitment to those who don't have shelter.
Yes.
You've been very clear about that. You and I agree that we have
Yes.
the money. We just
Yes.
got to put it where it needs
Yes.
to go. But as a doctor, what are your concerns for our communities?
So it is unacceptable in 2024 for one of the richest countries in the world, in one of the richest states in the world, which has the highest amount of reserve of funding, to allow their citizens to be unhoused and unsheltered. And this is a priority issue. This is a commitment issue. And that is where we have had these conversations that we as a state can do better. And this is all preventable. This is all early identifiable. And this is all completely fixable. But we need to put our minds to it. We need to completely put our focus on these policies to be able to address this. And it's a shame that we have to have these conversations every year to try and address this.
Dr. Saud, I want to point out that you have not only done policy work, you've done hands-on work on this issue.
Yes.
You've gone to different countries.
Yes.
You've seen how this can be done and how we can apply it. And other countries have had less financial resources
Yes.
than we do, and they're doing much more than we are doing.
Yeah.
How do you translate that experience that you have in other countries that we know you have been to
Yes.
into your position now?
So I'll share with you. Recently I was in Ecuador, and I was looking at the homelessness experience of the people in Ecuador. And when I saw this, it was heartwarming to see that the people over there have no resources, but they have the heart to be able to fix the issues. The people were so committed to helping the people who are experiencing unhoused status over there. And when I come over here, I can see that the general public has the heart, but as policymakers, we do not show the heart that we should show at this time. We have the resources. Now in Ecuador, people did not have the resources. There's no resource, but they're figuring out how can they help the people. And we have the resources and we're not putting it forward. So it was just like, how are we disconnected? Because the people in the community that I interact with, they want to fix it.
Absolutely.
And we have the resources and we're not doing it. And so that was a bit of a dichotomy that I saw that, oh my God, here we are as the strongest country and we are not able to fix this. And it was painful to see that.
Also, as a doctor, I'm sure that you see situations that you don't want to see, or you want to embrace more people.
Yes.
And having people have access to medical care, quality of medical care.
Yes.
What do you see are some of our challenges? Right now, we are in a tight race.
Yes.
And I will tell you right now, we cannot afford Trump. Right now, we cannot afford Trump ever. But
Yes.
right now, we must not let our democracy fall.
Yes.
Or say goodbye to it.
Yes.
Because that's what's at risk at this moment. this is a tight race. What do you see?
So, Lily, this is where there's such clear difference in the two groups. There's one group that says that if somebody's going through a struggle, it is their fault and we're going to make sure that they do not get better. Another person says we are all in this together. We need to make sure that everybody who's going through struggles, we actually can help them out. Keep in mind that each and every one of us will go through ups and downs in our lives. And when somebody's going through a down, it's the ones who are going through an up at that time, they hold the hands and say, let's do this together. And then next time around, when you're down, somebody else comes and holds your hand. This is how a society works. Every society in the history of society has worked that way. Now we have somebody who's saying that if you're down, I'm going to look the other way.
Or kick you.
Yeah, kick you at that time. Yeah. And that's a big difference. But I also, to your point, we actually passed a law last session, which was saying that homelessness is a public health crisis. Why? Anybody who is unhoused, anybody who's experiencing an unsheltered status, their health becomes a very big issue to the point that they have to be hospitalized, their lifespan changes, and we have an opportunity to fix this because guess what? We as a state are paying for that.
Correct.
How? Through the cost in the healthcare system, through the cost in the emergency room. But also these are people who want to work. If you can help them out, we are losing this workforce. And it's any money spent on prevention and management becomes tenfold more when you address that. And that's the problem, that we are actually losing these opportunities.
And it's so prevalent for us we forget how many people go into bankruptcy due to medical bills. And we forget to tell them about the funding that's available for them not to end up in that situation. You are very in love with the Latino community, and the Latino community is very in love with you. Everywhere I see you, I hear people talking to you, and they want to speak to you in Spanish, which is wonderful. What's that love with the Latino community? Where does that come from?
Well, the people are just amazing. They're the kindest group of people. Yes, so true. And so the people are kindest people. They are people who are family-oriented, the people who are struggling, hard-working. They roll up their sleeves every day and do the best that they can to help out each other, but help out the larger community. The infrastructure that we are building right now, it's based on the hard work of individuals. It's also people who give back. They are taxpayers. They are working on all the issues. They're my family. I look at them as my family. And then so now I've also been able to travel parts of the world. I've been to Mexico. I've been to the Puerto Rico partly, and I've also been to the Dominican Republic, but also Ecuador. And I've seen the people there doing good work, and also people I'm taking care of as my patients. And as a physician who's been in practice in this area for some 29 years,
wow.
I have seen people go through challenges, and I also see the humanity of the individuals. They are there to take care of their parents, love their parents and their spouses and their children, a caring group of people. And it pains me because Trump has actually tried to paint the people in the wrong manner, and then it could not be farther from the truth.
Yes.
So we have to stand up, and this is my community, and I say that if anybody is looking at my community the wrong way, they have to go through me.
Okay, we want more of those messages. Tell us what's your biggest concern right now with this election, a part of Trump winning? I mean, people are voting in silence and not telling you that they're voting for, unfortunately, Trump. Or I bump into people all the time who are saying, listen, I don't want you to touch my guns. I want everybody, unaware of access to health, because that's going to cost me money.
Right.
I don't want to take care of the poor, whatever the poor means in this. What are you concerned about? If this man gets to be the president of the United States and we don't end up with Madam President, we are in big trouble.
Yeah, this is going to be truly an opportunity. We are at a crossroad, and this is a very scary crossroad. And here's how I'd say it. I said, don't make any assumption. Listen to what the people are saying. Trump is very clear where he stands.
Oh, he's told us.
Yeah, and so if he's saying what he's saying, you've got to take it for the word that he said. And he is saying that there's no room for anybody who looks different, who believes different, who appears different, who speaks different. And this is not who we are as a country. We are a country of immigrants. And there have been waves of immigrants that have come, and they have been hardworking. They have been part of building up our society. And then that's what it's all about. So I know that we have to do whatever it takes to actually go with a vision, which is an inclusive vision.
Correct.
So we have somebody who said it's exclusive to them, and the other one is saying it's inclusive to all of us. So it's ours, that is what I'm focusing on. And that's the party that I'm part of. It's a party of all of us together. We are a group of families. We are going to make sure that we build our country and our home, and then work and stand up for each other. Each and every one, even for the people who don't agree with us, we are there for them too. We are all in this together.
It's democracy.
Yes.
That is democracy one-on-one, right?
Yeah.
What are some of your challenges that you see right now with this election for you? I mean, like you're running.
Yes.
What do you see right now?
Well, my biggest fear is that people just assume in the state of Connecticut that Democrats will win, and they will just not come out to vote. And then there are people who actually feel that there are aspects of our overall society that they're quiet, and then they're in their lonely point when they are going to have to make a decision, they will vote in the wrong direction, from my perspective. So we want to make sure that everybody comes out to vote. Every Democrat who does not come out to vote is actually electing somebody else with a different vision to vote. And that's why I want everybody to participate. I can say that our Latino community is a sleeping giant.
Oh, I like that.
Because they are actually not doing all the things that they should be able to do to mobilize. They're not doing all the things that they need to do to help out and then be part of the process of voting.
And there's lots of reasons why people are not doing that. And there's a lot of history behind why people have not been mobilizing. And there's a lot of history on why we've lost faith in politicians and in the infrastructure and all of that kind of stuff. But yes. I think the waking up, it is time for us to wake up and stand beside each other at this moment.
Lily, if not now, when?
Yeah.
Right? There's a person who has looked at the community and called all these names. Is directly focusing hatred towards a specific community. And even if that time the community doesn't wake up, when will they wake up? It's our time to stand up and then say, no, we don't allow that. Enough is enough. We are going to vote anybody with that vision out of the office. That's what we need to do. Make an example this election so that nobody in future could ever say things like that towards anyone in the country, any community in the country. It's one group or the other, and that's what people are doing, and there's no room for hate. We don't have enough time to love each other. How can we have hate?
Oh, I like that. I like that. Let's not forget, for all of you who always say to me, but you're biased. Yes, I am. I'm completely convinced from my heart, my soul, that we don't want Donald Trump. We can't afford Donald Trump. As a grandmother, I can't afford Donald Trump. As a woman, as a wife, as of a veteran, as a human, I can't afford Donald Trump. And let's not forget what he did to our beautiful Puerto Rico, el papel de toalla. Yeah. I am not going to, I can buy my own paper towel. And so the resources that did not get to Puerto Rico, the ports that were closed, all of the things that he could have done for us when Hurricane Maria destroyed our country. And other countries are living through that as well. So we can't afford to do that. Yeah. So it's more than just our neighborhoods, because many of us have families living somewhere else, and you will be able to sit at that table and negotiate for us as well. But if we have someone who believes that he needs to be a dictator and will never leave office, which clearly he has said. But so what do you say to the folks, not that you can, this is my wishful thinking, I can't get one of my gowns to find housing because they have a felony, but we have a felon running for president. It's like it's if that's one example, which is such a clear example. The other example is you go to your local Dunkin' Donuts, and you have an employee who speaks in that manner, and you're the manager. You're going to fire that person right away. You'll never hire them. And now for the highest and the most important office, which has an impact on the lives of every single American, but also people across the world, we are having somebody that we would not even hire in your office to be in that office is such a travesty.
and there are people who want to support that. And it's some people say they're doing it for religious reason. I said, what religion are you talking about? Because he's not following a path of any kindness that is part of every faith. It's not following a path of being decent and nice and respectful for his even family. And how do you expect that to be a part of a faith? So I can't make those connections. But at the same time, I say, okay, you have that right. I respect that. But at the same time, after the election results are out and hopefully the people make the right decision, you all have to calm down, because we need a society where we cannot be so divided. It's not healthy for any society to be divided like this.
Well, I can't imagine why somebody will hire you as a doctor. I'm like, there's nothing wrong with me right now, but I would hire you as a doctor, and I definitely love that you are running again. I gave this opportunity to everybody else. I'm going to give it to you. You can only have one, Dr. Saud.
Yes.
Only one wish. If you had the magic wand and you could create one policy, one wish, what would it be? Only one.
Yes. Yes. And I have thought about this in the past.
Have you?
You did not tell me. I would, if I had a magic way of doing this, I would actually spread empathy in everyone.
Okay, I take the magic one back. I want that one. I want that one. I think it's so great. God bless you in my belief. And hopefully we're going to walk together for a very, very long time.
Amen.
I love your work. I'm a fan of your work. And I hope we just can continue to work together. And aquí están los que de verdad están trabajando para ti. Nos vemos próximamente.
Muchas gracias.